Hi, welcome back to the Chinese Medicine Podcast. I'm Mary Hopkinson. I'm a Chinese herbalist and an acupuncturist, and today I'm going to be answering a student's question on the channel. And so we're going to be talking about diagnosis and how to make a diagnosis in Chinese medicine. So let's look at their question first off. So this person says, "Hi, I love your channel." Thanks for that. I go to school for Chinese medicine and I'm a year and a half in. So that if you're not familiar with how long school takes, it's sort of like 4 years. So sort of good on you for lasting the first year and a half. Because it's not easy. I'm not doing that. I'm not saying that sarcastically or anything like that. Like, it's really hard. The first year is really hard. There's a lot higher amount of people that drop out because it's just so difficult to learn to grasp some of the concepts at the beginning of Chinese medicine school. This is her question. I'm having trouble comprehending diagnosis and how to diagnose someone after I complete their SOAP note. Could you maybe do a video on that and what helps you to understand diagnosing? So I had to ask her, what's a SOAP note? Because I've not heard of that before. She says it stands for subjective, objective, assessment and plan. It's the questions we ask the patient, like the chief complaint, stress level, sleep, diet, tongue, pulse, etc. And I said, maybe I'm old school. I'm probably calling it the 10 smart questions, which is what it's commonly known as, or the 10 questions. Or when I was taught in Chinese medicine school, our teacher used to just colloquially call it the 10 smart questions, but he always referred to it as the 10 question areas. Like, they're not actual 1, 2, 3, 4, 5 questions. They're question areas. They're referred to as the 10 questioning areas. Now, I'm actually really passionate about this area, so I'm glad you've asked this question because I really want to be able to answer it and to help students. I find that this is a really common issue, not just because students don't know, but I think it's just because you're thrown into the clinic so early, and that's normal. I mean, how else will you learn? So it's just part of it. The earlier you do get to see patients or be involved in that process, so let's just go back a little bit, because this channel, I get to kind of give my 2 cents on things. And so I'll give you a reason why I think it's harder for students to get this in the learning environment that we have now. And most schools around the world follow this process. So you go through theory, Chinese medicine theory, for 1 or 2 years. And a lot of schools, they start exposing students to practical in second year. So second year, first semester, they started to being exposed to student clinic. And the first exposing you have to the student clinic is watching other students practicing. So these should be 3rd or 4th year students practicing. Some of the students you might observe might even be the first time they've done it. They might be second year, second semester. So like basically 6 months ahead of where you are, you're observing that person. Now, that's a very common model, right? That's all over the world, kind of practice like that. Before that, you are exposed to seeing how a Chinese medicine practitioner would work, but it's not in a real clinic environment. It'd be in a classroom environment. So a teacher might do a diagnosis of a student, let's say, or sometimes in classes, students bring in family or friends or someone like that, and they do the diagnosis in the classroom for the first time. And so what you have is the opportunity to see the teacher do the diagnosis with the patient. Then sometimes the patient goes home or goes out, and then the teacher and the classroom can kind of discuss the case, and they can discuss really, maybe in a 3 or 2 hour time slot, they could discuss, maybe 1 or 2 cases. And so you are getting like an in-depth view of how they would do that and how they would go about it. But what I'm getting at is, never in this process have I seen schools really adopt a model where they send students out into the world to watch real life practitioners doing it. There's lots of reasons for that. One is because, it's called work experience, basically. You could be exposed to a terrible practitioner, and that would be you're only exposed, being exposed to. I feel like I'm saying exposed a lot. That would be your only opportunity to see it in action, and I think that's actually better than nothing at all. And I do encourage students that I come across from time to time, and I'll say, look, when you have downtime in your study period, like if you're going through a big holiday break or something like that, try to find a practitioner that you can go and do some observation with, especially someone that's local to you, or someone that's doing a different style of Chinese medicine to what you've mostly been practicing, because it's that now's your opportunity to kind of look at and see how do they do things, how do things happen in the real clinic versus how are they happening in a student environment. So in the student environment, it's very slow, and it's sort of like painstakingly slow, whereas in the real world, you're sort of watching this practitioner and you're like, whoa, they only asked 3 or 4 questions and now they've given the diagnosis. How did they do that, right? And that's what happened to me when I went to China. And I think, I've often told students you should definitely go and do your internship in China. And if you don't do that, you could still get the same experience if you did an internship with someone in your own country who was very, very busy and was able to let you shadow them, basically, let you watch what they do, especially in herbs. Like, you don't have to actually, dispense out the herbs, let's say. I mean, it's fun if you do, but you don't have to do that. You're just watching the questions they ask, the pulse and the tongue, or, however they got to the diagnosis, and then how they get to this formula. When you go to China and you do an acupuncture internship, you get to actually do the acupuncture, on the patients as well. And so that just gives you a ton of experience. But one of the things that shocked me when I was back in China, this was like I was in China in the year 2001, was that, the year 2001, was that, like, they hardly asked any questions. Where is these 10 smart questions? Where are all these questionings that we were told we have to ask? How are they getting to this diagnosis so quickly? And so it's good to be exposed to those kinds of things, because sometimes there's particular questions and particular things that are like so important, and they're kind of what I call the hang your hat symptoms too. So that's what I tell my patients. Like, they're so important, they're so meaningful. They only mean 1 or 2 things, or they really help divide and differentiate between the different patterns. So my first advice to you to answer this question, and the reason why I'm giving you that story is kind of to say, well, it's kind of, you're learning how to do this from other students rather than learning how to do this from practitioners mostly. And I think that's not the greatest way that Chinese medicine's taught. If you look back in the history of how Chinese medicine's being taught in a lineage system, then you would be watching an experienced teacher. Now, the bummer about that is one experienced teacher can only have 2 or 3 people watching them at any one time. They can't train a classroom full of 12 to 50 students at a time. They can only train 3 students. So it's not a viable it's not a viable way to do that. And these days, with degrees and accreditations and things like that, you're not going to get a degree by going and shadowing someone for 4 years. And you definitely need the university system to teach you all the theoretical knowledge of this stuff, let alone all the legalities of practicing and things like that, right? You can't learn that in a lineage system. So I'm not saying we need to go back to that, but I'm just saying that's a critical part of how you learn is, with the first people you're watching, how good are those other students, and how exposed to other practitioners in a real life scenario are you? And I think that may help in some cases. Now, that may just not be possible, especially right now if you're watching this video when I'm making it in the middle of 2020. Lots of places are still in lockdown or difficult times because of COVID. There's just people can't practice or as they normally would, and things like that. So that may not be even possible at all. And maybe you're not even able to attend your student clinic like at the moment. So to help you understand the process of diagnosing, I think the first thing to say, which is really, really important, the most important thing I could tell you was, the more you know what the diagnostic criteria are for those labels. So let's say you're going to use a Zhang Fu system. I don't know the school that you're studying. So there are different schools of Chinese medicine. There's the 5-element school. There's the practice of Chinese medicine that I learned was the Zhang Fu system. I mean, we learned about other systems, but you didn't end up practicing other systems. Like, you learned about the 6 divisions, but you never were practicing that. You were learning about 5-element theory, but you never were practicing just according to that. So whichever system you're practicing according to, it could be any of those, you need to know the parameters of those diagnostic criteria. You need to know the patterns of disharmony if you're doing Zhang Fu system. So if someone's got a blood deficiency, you need to know those symptoms when you're asking the questions, rather than just letting it be like, okay, I'm just going to fire off all these questions to you. it won't, for a start, it won't seem like it flows very well, and also it won't help you to kind of understand, well, what does it mean? So that's my second point, is when you ask a question to the patient, whichever it is, whether you have to ask it because it's on the sheet, or if it's something that you're, that's coming to you because you think, oh, they've said I have, that you've noticed that they've got pale skin, and you thought maybe they have blood deficiency, so I'll ask them, do they feel lightheaded or dizzy? So you've just come up with that question, right? It's not like in an order on a page or anything. You've just asked that question. Why are you asking that question? Whether it's something you've come up with or whether it's on the page, you should know, what does that answer mean? If they said, if they said, yes, I have lightheadedness, what does that mean? And this is a tough call, because when you're in first or second year, or maybe let's say this is probably second year or end of second year, when you're first learning to do this, then it's hard to remember all this stuff, right? I can understand that, but that's where you should be aiming to be. That's what you should be aiming to think of. When I ask a question, I should know what that answer means. And so if it's a yes or a no to that answer, like, what does the positive or the negative of that mean? How important is it for you to get that information properly? Like, that's another thing. Sometimes when you're asking the questions, you ask them like, how's your, you want to know if they have loose stools or constipation. If you're going to be prescribing herbs versus giving them acupuncture, unless you're doing a very strong, like, moving the bowels treatment, let's say for someone with constipation, generally with acupuncture, you're not going to be able to cause them to have diarrhea. Whereas if you give them herbs that are like a purgative kind of herbs, and they've already got diarrhea, then, they're going to know about that, and they're going to feel really uncomfortable. And they'll be calling you the next day saying, what? Like, I can't get off the toilet or something like that, right? So if you ask them a question, you say, how's your bowels? And they say, oh, they're normal. So you sort of tick, well, they must not have diarrhea. Well, you might have missed something, because what's normal to them could be, who knows what it is, right? So you need to clarify these things and make sure, especially when these things are important, like to the diagnosis or to the treatment that you're giving them. And so that's so one way of thinking of the diagnostic process is you're a detective, right? So you're sort of thinking, okay, I need to gather up all the evidence, and how you gather the evidence is the correct evidence, right? So by asking them, how's your bowel movements, and they say, oh, they're good or they're fine, that's not really enough evidence to be sure, right? Especially if you've never met this person, you've never asked them that question before. So you need to clarify it and say, okay, so you go once a day and they're properly formed then. Something like that, right? So you really know that especially as in a student sense, because you might come back to your supervisor or your clinic supervisor and they'll say, how's their bowels? And you say, oh, they're normal. And then the teacher might say, so they're once a day, like what you should have asked the patient, right? So they're once a day properly formed then. And you're like, I think so, because they said they were normal. The patient said that, and sometimes when you first start practicing, you don't realise that people have all these variances which they think are normal. So I've had some patients that go once a week and they think it's normal because they've always done that. So it might be normal to the patient, right? So they're not lying. It's normal to them and it's not causing them any discomfort or any difficulty, right? Because they've managed it, they've learned to live with it. And also, let's say they're coming in for a back pain and they're just like, well, why are you asking me about this? So that brings me to the next point. If you understand why you're asking these questions, it makes it easier to ask patients lots of questions about things that might be seemingly, or probably are seemingly unrelated to their main complaint. So that's the first thing that I think is really important. And then secondly, not secondly, but next, there's a lot of little points in here. And look, this isn't an exhaustive tutorial, but these are just my tips and my advice to get you started. And maybe I will make a longer video on this as well, and possibly could go through, some case study or something like that as well. I think what's really important is at the very start of the process, you ask the patient what's the main thing that's bothering them. What do they want? Now, some patients have 5 things. I've had patients before that said, well, I've got this neck pain and this lower back pain, but I've also got irritable bowel syndrome, and I've got this, and I've got that. And they've saved up all these health problems. And that's fine. That's what some people do. But the strategy in which you're going to treat the back pain in an acupuncture sense might be different to an internal medicine problem like the IBS symptoms, the irritable bowel symptoms. So I think at the very start it's a good idea to differentiate what system you might be wanting to use. So would you be using, have they got a musculoskeletal condition? And if so, are you going to use a musculoskeletal approach? And so in all of the process of what you're doing, now I'm not trying to override what your teacher's trying to teach you or your school's trying to teach you. Please follow what they've said, because they've asked you to do something for a reason. And that's super important. And I think it's really a good thing to follow instruction, not blindly into a hole, but to follow, like if you've got a teacher at a school, there's a reason why they're teaching you. They've got some knowledge there. They must have some kind of idea. And so, you know, they're probably asking you to do that with good reason. Now, not every teacher is really great at explaining why they want you to do something. And sometimes that can be a little lesson in reverse to kind of realize, well, sometimes patients can get really frustrated when you start asking them all these questions that are seemingly unrelated to their problem, especially when the time goes on and on and on. I'm talking about in a student consult, right? So you might want to say to the patient, right, okay, acknowledge that that's their main complaint. So let's say they've got a headache and they've got pain. And you might say to them, look, the system of Chinese medicine I practice can look at lots of other internal imbalances, or in order to look at your headache, we need to know if there's something else going on. So I'm going to ask you a whole bunch of other questions about your general health. Is that okay? So at every step of the process, you should be getting informed consent. So you need to get, consent to ask the questions about the different things. That's kind of implied consent in a way that a patient's come to you, they've signed the consent form when they've come in, let's say they've done that. And like they're giving you some kind of consent to ask about their health problems, because that's sort of understood that they're going to be doing that. But when you're going to ask more specific questions or more personal questions, let's check the time, more personal questions, then it's really important that you ask that informed consent like that. And you preface the reason why you're doing that. So kind of so your patients don't think you're just being nosy for nosy's sake, and they understand the why. So if someone understands why you're asking something, they're much more likely to be more honest with you, give you a better answer for it. So if you're stuck and you think, well, Marie, it's all great that you said I should know my patterns of disharmony, I should know those diagnostic criteria, I should know that, but I don't. Help me. I don't know. So what you would do is you would collect up all the information that you can collect up as best as you can, as gently as you can, without trying to be an inquisitor, like bang, 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 here's all my questions. And then what you do is when you sift through that information, maybe you do this with a fellow student or you do it with your supervisor. I encourage my students in the clinic usually to do it before they see the supervisor, if they can, if there's time, especially if you're waiting in line to see a supervisor before you discuss the case with them. And you go through the symptoms, and you would think this is what you should be doing in the clinic room, but you might not be able to do this yet. And so you have this list of symptoms, and so you look at it, and you might, let's say if you're using that 10 SMART questions list, and so the first one's usually like chills or fever, and so you've no chills or fever, right? Well, that rules out an acute pathogenic attack. It rules out that it's not a Tai-Yang condition, right? It's probably not a Yang-Ming condition either, if they don't have those things going on right now, like, or in the last couple of days, right? It means that it's not, from a Zhang Fu perspective, it's not like an exterior pathogenic attack. That's what they'll call it. I had to think hard for a minute then. So yeah, like an acute wind heat or acute wind cold or something like that. So let's say you've got that. But within that chills and fever question, there might be things like heat. Do they feel a feeling of heat? And you've got, they feel hot. They feel hot at night. They have, and then maybe a question flowing on from that would be like, well, how's your sleep? And so their sleep might be poor. And so they said they've got insomnia and they've got difficulty sleeping and they feel hot at night. So as a student, you're kind of thinking, what does that mean? What does that heat mean? What if you're using a TCM pattern of disharmony thing, then you would say, what patterns relate to this symptom? What could it relate to? So could it relate to 2 or 3 patterns, or does it just relate to one pattern? So for instance, a symptom of diarrhea or loose stools could relate to many patterns. So it's not what we would consider a hang your hat symptom, or what I consider that. I just use that. Hang your hat means like it's a nail on, you know, it's definitely that. A good example I give to students in that way would be like, let's say, spleen qi deficiency versus spleen yang deficiency. So in TCM, they think of spleen yang deficiency like this cock crow diarrhea with undigested food in the stool. So it's like the more looser it is and the more unformed it is, like it's all the time unformed, it's never properly formed. There's sometimes could be undigested food in it. I think it's kidney yang deficiency that gets the cock crow diarrhea. So they basically wake up at 5 a.m. to run to the toilet and have diarrhea. So that would be much more towards a yang deficiency patient versus just a qi deficiency patient. Would be someone that's got loose stools, but then maybe they're not always loose, or they're not as loose. They're sometimes a bit formed, but they're soft stools, or they're sticky, that kind of thing. A symptom where there's a strong smell in the stools and it's only been going on for a few days, it's acute, and they're loose, would much more be like damp heat somewhere, damp heat in the intestines, or damp heat, you know, the lower jaw, or whatever you're going to use to make the diagnosis. So what I'm getting at is sometimes one symptom can mean multiple things, and it could fit into many patterns of disharmony. And sometimes one symptom can fit into only one thing, and so that's a really important thing to remember what that means. The other difficult thing is, look, patients are complicated because they can have things going on for years and years, and they can have lots of patterns of disharmony. And I think the system of TCM isn't so great. Like, some practitioners are good at differentiating sort of like a flow of what's happened, so you can see things moving from one to the other. Some things are so intermingled that it seems complicated to make that diagnosis, because it is, because they have like spleen qi deficiency and liver qi stagnation and maybe heart fire or something like that. And so you can kind of utilize, and I would encourage you to do this, is to utilize that 5-element system to think about how these interrelationships are hurting each other, or helping each other, or causing each other. That's really useful. And then finally, before we finish this video, this is just tips and a little bit of advice. It's not a it's not a thorough video. The last thing I would say is there's a really great textbook called Patterns and Practice. 2 or 3 volumes, I think they've made of that, maybe 1 volume. And what the guy does in that book is they go through cases. So they have poor appetite, let's say, and they ask these questions, which are really important. And it says, why is the loose stools in this case spleen qi deficiency and not spleen yang deficiency? Right? And these are questions where you think, yes, why is it? I don't know. And they'll give you like a paragraph of an answer about that. And I found that book really helpful when I was learning TCM, the basic foundations of TCM, and that's what I practiced for the first probably 10 years of my practice. And so that's very useful in helping you learn those patterns of disharmony. So if you've got a library, get that book out of the library and have a read of that, and let that help you with your cases, that differentiation. So I hope this video has been useful and helpful to you. Good luck all the students out there. I know it's difficult times right now. My heart goes out to you. I know it's hard. You're halfway through or quarter way through, and this person that's answered here said, you know, is 1.5 years into it. You know, it's a hard road being a Chinese medicine student. So good on you, but it's a great profession to be in. So if I can encourage you to stick with it, you know, there's light at the end of the tunnel, and the world needs Chinese medicine practitioners more than ever now. Our health is paramount, like, importance, and there's going to be a place for people. I think they're going to be looking to, you know, things that are more tried, tested, and true. You know, as the world just looks to their health, and not just that, but Chinese medicine's a great system that kind of encompasses this knowledge of how important it is for us to live in harmony with our environment, in harmony with our food environment, and in harmony with nature and things like that, and to acknowledge that, you know, there can be detriment to us when we're not doing that. So good luck with your studies, and I look forward to seeing you guys again on the next video soon.